Wow. That was so easy. Good. All right, so today we have one of our pregnant moms who's 28 weeks pregnant, and a lot of our pregnant moms come in and really love this table because the middle part here breaks away and they're allowed to lie in their stomachs, which for pregnant moms is sometimes feels really good to be able to lie on their stomach. And so what I tend to see a lot of times, the most common thing we see with pregnant women is sciatica. So that's pain down there, into their glute, down their legs sometimes. And McKenna today has a little bit of pain on this left SI joint, but her right QL is very tight as well. This is another common thing we see is the QL muscles as the baby grows and as they get more weight in the belly, we get really tight QL muscles. And the QL attaches to our iliac crest here and comes up and attaches to the lumbar spine. So what I'm able to do is kind of push into this tissue and deviate her legs to the side, and it helps to loosen up this QL muscle here. So we're going to kind of dig in like that. And a lot of people feel the pain right on the rib here. It actually attaches to the 12th rib, and so the QL muscle, we can deviate their legs from the right to the left and stretch that out. And so as I'm pushing into it with my fingers, I deviate her legs to the left, which helps stretch out the muscle and loosen up that QL. Yeah, a lot of times you feel it up there in the rib too.
Yeah.
Yep. And so sometimes too, I kind of hook my thumb around the side of the QL. Right there is where I feel it. Yeah. Good. And typically for my pregnant patients, their first and second trimester, depending on the patient and kind of their history, most of my pregnant patients come in, couple times a month in the first and second trimester, but then once they get into the third trimester, typically between 30 and 40 weeks or 35 and 40 weeks, that's when they typically come in a little bit more often, maybe weekly or twice a week at that point. And this research shows that pregnant women under chiropractic care tend to have less complications during their labor. Their labors are shorter and they tend to have an easier birthing process because we can get the pelvis and everything loosened up, less chance of a C-section too when pregnant women are under chiropractic care. And it's perfectly safe, there's no contraindications. We can't do any of our therapies like dry needling or anything like that, but the chiropractic adjustments are 100% safe and there's no contraindications for pregnant patients. Has this QL been bothering you, McKenna, or not as much?
Not as much.
Yeah. Until I dig into it.
I was just gonna say until you dig in, and I'm like, oh yeah, right there. Yeah.
Another common thing we see too with pregnant women is, even specifically for McKenna, she always had right-sided lower back pain, and when they tend to get pregnant, sometimes that pain shifts. So because I've known McKenna for a long time, she's always had this right side has been usually her main area of complaint. And now that she's pregnant, she's getting more pain on the left side, which is very common because the baby tends to rest on one side more than the other, and it can shift the pain from one side to another. And then we're gonna stretch out her neck too. You said you've been having headaches?
Mm-hmm.
Just some gentle cervical traction like that feels really good. It separates the vertebra and decreases the pressure on the discs. Yeah, right up in there. Mm-hmm. Now, do you notice the headaches on the left or the right, or they're just all over, McKenna?
Left.
Yeah. So we can feel up here in her upper cervical on the left side, she definitely has a knot or a trigger point there. And that can sometimes refer up into the head, causing headaches. Promote a little bit of lordosis in the cervical spine. So it does get a little bit more. Now at 28 weeks, McKenna's pretty easy to adjust, but it does get a little bit trickier as the baby grows and mom's belly gets bigger. We want to make it like comfortable. Like, does that push into your belly at all? That's okay. Wow, that was so easy. Good. So
It's crazy because like once you press on it, I just feel it like radiating like right into.
so I feel on the right too, a little bit there too.
Yeah, a little bit, but not as much as that left.
So we're gonna loosen up the suboccipital muscles here. And you have this suboccipital triangle right at the base of your skull.
Woo.
So we just laterally flex and rotate the head.
Oh my gosh. Oh, yeah. Oh. This is preparing for labor. If you can withstand the pain of that, you can withstand the pain of labor. Jeez. It's so funny because I felt like, well, I better not speak too soon. I was like, wait, hold on.
You can tell you've been a patient for a long time. Made that mistake before. Oh, that side's not as bad. Okay, never mind.
Mm.
So traction feels really good. So what we do is I just get my fingers at the base of the skull and just as a very gentle push, but that feels really good, right, McKenna?
Yeah.
So this is right where that suboccipital triangle is, and when it gets really tight, it kind of just compresses the skull onto the base of the neck. And so just doing some very gentle traction right here on the occiput, which is the back part of the skull, feels really good to open up that space. Because when those nerves get compressed, we have patients tell us they suffer from things like headaches, like McKenna said, or sometimes it's vertigo, or just dizziness, sinus issues, sometimes just overall fatigue for no reason. It's a very important part of the spine because this is where your brain stem from your skull goes into your spine. So the upper cervical, the C1, C2, the suboccipital triangle is a very important area to treat. Yeah, see already how much more relaxed that is?
Yeah.
So.
Mm.
Maybe a little bit.
Man, that felt so good.